Speaking of ART with chiropractic, do you bring in ART right away with the chiropractic, or do you do some basic chiropractic and then bring ART in?
I do ART on every single treatment, every patient.
Okay,
So,
just wanted to make sure I understood the differences between that. Okay, and so once the patient's gone through the acute phase, what is the next phase, and how do you address their expectations with treatments and recommendations you make after treatments, and how often you see them?
well, once we get through the acute phase, then we kind of start trying to stretch out treatments, try to get them back towards feeling good and staying that way. That's kind of like the recovery phase, where I'll start decreasing frequency, maybe going from the twice a week to once a week for a few weeks, and kind of until they hold that well, and then maybe add a couple extra days, so they're going a week and a half, and then to 2 weeks, and trying to make sure that they are able to hold that time and without relapse. So if they're staying pretty good there, then we know that we can keep stretching it out. If they're set for a week and a half, and 5 days later every time they're kind of hurting again, it's like, okay, maybe they're not quite ready for that recovery phase yet. We still have to do some more work and get them to handle that and be able to hold that the whole time.
So in doing that, your education process, you're letting the body tell them as well as tell you what the schedule should be.
Right, I mean, it's basically what the person feels. They know better than I do how they're feeling when they come in.